Hi, this is Stephen, and in this video we will put together what we've learned from all the other videos to assess diastolic function, or how the heart fills with blood. And so for this we are going to use some of the parameters that we have been talking about at length. So we are going to look at our E prime, and there is both a septal value and a lateral value. E prime, it is less than or equal to 6 at the septum, or at the lateral aspect if it is less than or equal to 7 centimeters per second, or on average, what's the average of 6 and 7? 6.5. What does this mean? This means that the wall is not moving well. Or if our E over E prime, remember that can help tell us what the an estimate of left-sided filling pressures, if that is over 15, no units on this, or if it is over 13 at the lateral aspect, or if it is over 14 on average, that means that we have high pressures during diastole. And then our tricuspid regurgitation. Tricuspid regurgitation, the higher that is, that also suggests that we, for this there's no septal versus lateral, it's just one number, 2.8 meters per second. The higher that is, the more tricuspid regurgitation. It suggests we've had diastolic dysfunction for some time. So these are the three parameters that we're going to evaluate. And what we want to see is if all three are normal, if all are normal, then there is no diastolic dysfunction. Normal. On the other hand, if all of them are abnormal, all three parameters are abnormal, then we definitely have diastolic dysfunction. And what grade? Well, we look at the mitral inflow to decide that. And so if we see more of a pseudonormal pattern, that would be considered grade 2. And if we see more of a restrictive, where the E is more than double the A, then we would call that grade 3. But all three of these parameters here, if all three are abnormal, if E prime is too low, if E over E prime is too high, and if your tricuspid regurgitation is too high, that means we have some kind of diastolic dysfunction with elevated filling pressures. We just have to figure out whether it is grade 2 or grade 3. Now the middle is a little trickier. For the middle, I want you to remember one little exception, and that is that if only E prime is abnormal, so if E prime is low, but everything else is normal, and you have this kind of that impaired relaxation filling pattern, we call this grade 1. So the wall is not moving as well as it should, as fast as it should, but all the other parameters are normal. This is impaired relaxation with normal filling pressures. Now, what if you have some other combination though? You have, just E over E prime is abnormal, or E prime and TR is abnormal, or some combination. It's not all normal, it's not all abnormal, but one or two of these parameters is abnormal. I'm going to put this kind of in parentheses here so we don't get confused by it. Then we look at additional parameters. And so then we can look at, do this in blue, then we can look at our S to D ratio from our pulmonic inflow. We can look at our left atrial rate of strain, which should be less than or equal to, which abnormal would be less than or equal to 18%. For all of these, I'm writing the abnormal. We can look at our left atrium volume index if it's all stretched out and it's greater than 34 mil per meter squared, or if our relaxation time, IVRT, is less than or equal to 70 milliseconds. So if you have some combination of abnormalities up here, maybe one of them, maybe two of them, but not all three, then you go to these secondary parameters, And if you have one or more of these secondary parameters that are abnormal, they function as the tiebreaker. And so then if one or more is abnormal, you go this way. If 1 plus abnormal, and if all are normal, then you'll go this way. If all normal. So just to recap once more, we start with E prime, E over E prime, and tricuspid regurgitation. If all are normal, we have normal diastolic function. If all are abnormal, we have diastolic dysfunction with elevated filling pressures. We just figure out the grade based on the mitral inflow pattern. If we have, one of them's abnormal, two of them's abnormal, but not all three, then use secondary parameters. And if either your pulmonic, venous inflow, your left atrial reservoir strain, your left atrium volume index, or your IVRT are abnormal, that pushes you into the abnormal diastolic function. And again, you look at that E over A ratio to decide whether it's grade 2 or grade 3, but regardless, you have both impaired relaxation and elevated filling pressures.